Can you tell me, please, your name and your age and why you're here?
My name is Carolyn. I'm 67, and I'm here for a checkup.
Good. Patient is alert and oriented ×3. Patient's nutritional status is appropriate for her age and her body build. The patient's posture is upright. The patient has good personal hygiene. Her mood and affect is appropriate for the situation. No abnormalities noted. Looking at the patient's skin is appropriate for her skin tone. Yeah. Okay. Looking at the patient's head, her head is normal in size and shape. Looking at the hair distribution is even. No lumps or bumps noted. Okay. Now I'm going to, can you smile for me? Stick out your tongue. Going to palpate the patient's, can you remove your glasses? The patient's maxillary sinuses and her frontal sinuses. Any pain or tenderness noted there? No. Looking at the patient's eyes, her sclera is white. The conjunctiva is pink and moist. Sorry. Can you look straight ahead? Can you follow my light? Okay, the patient's pupils are equal and round and reactive to light and accommodation. Moving along to the patient's ears. There is no excessive drainage. Do you have any pain with me touching your auricle or your tragus?
No.
Good. Any pain?
No.
The patient's ears are symmetrical and in correct position on her face. Looking at the patient's nose, I noticed no type of septal deviation, no excessive drainage. Can you breathe in and out? Good. Breathe in and out. The patient's nares are patent bilaterally. Looking at the patient's lips, her lips are consistent with her skin tone. No cyanosis noted. Can you open your mouth and say ah? The patient's tonsils are at a +2. The patient's uvula is midline and rises and falls midline. Looking at the patient's neck, her trachea is midline, no deviation noted. And I'm just going to feel for lymph nodes. The pre-auricular, post-auricular, right behind the ear. Occipital is a little further back. The posterior cervical chain, up anterior cervical chain, supraclavicular, tonsillar, submandibular, and submental lymph nodes. No lymphadenopathy noted. All right. Can you kind of turn a little bit to the side? Please scoot up a little bit to the All right, looking at the patient's posterior chest, she doesn't seem to be in any type of distress. Can you breathe in and out? Good. Patient's chest expansion is equal bilaterally. Now going to assess for textile fremitus. Every time I touch your back, can you say 99 for me?
99, 99, 99, 99, 99, 99, 99, 99.
Very good. Now I'm just going to percuss, listening for flat sounds over bony areas and dull sounds over hollow areas. Okay. Next, I'm going to listen for breath sounds. Can you take a deep breath for me? Posterior breath sounds are clear to auscultation bilaterally. I'm going to listen anteriorly. Deep breath. Breath sounds, anterior breath sounds are clear to auscultation bilaterally. Now I'm going to listen to heart sounds starting at the aortic valve, pulmonic valve, Erb's point, tricuspid valve, and then last is the mitral valve, which is found mid-clavicular line, left of the sternal border, fifth intercostal space. And I would listen there for 1 minute. Patient's heart rate is 68 with a regular rhythm and rate. Okay, so now you can sit back. You can lay back, sorry, you can lay down. Right. Looking at the patient's abdomen, it is normal to contour, it's flat. Looking for any obvious pulsations. Right, next I'm going to auscultate for bowel sounds starting in the right lower quadrant. Bowel sounds auscultated in all 4 quadrants. Next, I am going to percuss starting in the right lower quadrant. Any pain or tenderness. And so I'll start with lightly palpating. Any pain, tenderness. Then deep palpation. Good. Okay, you can sit up now. Then I'll look at the patient's arms and I'll note that her skin tone is even and consistent with the rest of her body, checking for pulses. Pulses are regular in rate and rhythm bilaterally, checking for capillary refill. Capillary refill is less than 2 seconds. Can you raise your arms up? Down, out. Patient has full range of motion in her upper extremities. Then I'll move on to her lower extremities, checking for pulses, dorsalis pedal pulse, and posterior tibialis pulses. Her pulses are regular in rate and rhythm. Oh, can you lay down? Assessing for a range of motion in the patient's lower extremities. Lift your leg up, bend, out. Thank you. Up. Very good. Patient has full range of motion in her lower extremities. Okay, you can sit up. Next, I'm going to test for the patient's cerebellum function. Can you put your hands back and forth really fast? Good. And bring your heel against your shin. Pull down.
Oh, and then
Patient's coordination is intact in upper and lower extremities bilaterally. Next, I will check for reflexes. Can you bend your knee kind of like just sit? All right. The patellar reflex. This is a hammer. Okay, good. Patient's patellar reflexes are intact. Plantar reflexes. Good.
that tickles.
I'm sorry. Oh, can you hold your hand up and relax? Brachial reflexes. And can you stand up for me? And put your toes up and down. Very good. Walk back and forth. Not so you can come back. And the patient has full range of motion all over. Oh,